I don't know what my life would have been had I not done the test.
The screening program is important because bowel cancer is so common. Each week in this country, on average, 80 Australians will die. And in fact, Australia and New Zealand have the highest rates for bowel cancer in the whole world. Bowel cancer is a very common cancer. It's second most common internal cancer in this country. As a cause of death from cancer, it's second only to lung cancer. Fecal occult blood testing is a very effective method of screening a population. We need a test that can be performed by 5 million people. We have the highest level of evidence that it reduces the number of deaths. The NHMRC guidelines, these are the official Australian national guidelines, are that healthy people over the age of 50 should have screening for bowel cancer based on fecal occult blood testing. And they're advised to have the test once every 2 years.
My circumstances when I decided to take the test were that I got sent the kit a couple of weeks after my 65th birthday. As a GP, I felt that this is a really important test to do anyway, but had a colleague who had died in his 50s of bowel cancer not long before that. So I did the test within a few days of it arriving.
The program wouldn't be able to operate without GPs. They're really important to its success. And one thing that they can do that is really important is help encourage participation. We know that a GP saying that bowel cancer screening is a good thing to do will really help encourage patients to get involved.
I think it's important for the over 50s to take the test because colorectal cancer or bowel cancer becomes more common the older people get, and at 50 people reach the stage where it happens commonly enough to warrant screening. The other big issue with it is that we can either pick up lesions that can lead on to a cancer at a later stage or pick up very early cancers at a stage when they're curable.
Well, I saw the specialist and I had a colonoscopy, and he said that I needed to have an operation. I had a laparoscopic right hemicolectomy done, which was removal of part of the bowel, and when they sent it away to do a biopsy, they found there was cancer there and had gone through the bowel into the lymph nodes, which meant I did need to have chemo.
We're hoping that GPs actually instigate a conversation about bowel cancer screening with all their patients over the age of 50, but particularly the patients who are eligible for the national program, because they can actually flag with them that they're likely to receive a kit in the mail. They can explain how the kit works and help allay any fears that people might have around screening and whether it might be difficult or how it's all done.
I think a lot of GPs do miss that opportunity, again because they're very busy doing lots of other things, and again because a lot of the sort of awareness campaigns and promotion campaigns for colorectal cancer is something that are relatively new and hasn't quite been on GPs' horizon. And I must admit, before this happened to me, it really wasn't on my level of consciousness at the level that it should have been.
The program is a population screening program which is integrated with the normal delivery of healthcare in Australia. It functions with a central register which is based in Medicare, and the register identifies those who are eligible to have screening. It sends out invitations together with an information booklet, a consent form and the test kit.
It's really important that we get information back to the register. That's our only way of monitoring whether or not the program is successful overall. And it's also the way that we can be confident that everyone who gets a positive is actually followed up with a colonoscopy.
General practitioners should understand that reporting back is as important to the program as providing participants with correct advice.
My advice to GPs who think, are sort of really, really busy, and we're all really, really busy, is that, again, from a time point of view in promoting this, it's a very small part of a consultation. Probably only takes a minute or so to do it. Virtually all of my patients now who are in that age group, I check when they're about to turn 50, 55 or 65, and then I proactively bring it up and say, after you have this birthday, you'll receive this kit and encourage them very, very strongly to do it.
There's a lot of information that's available for the GP and the practice in a written form, so information can be handed on to patients, but also we're hoping that it's seen as a whole of practice approach to bowel cancer and bowel cancer screening. So the practice nurse can play a role, there can be information around in the waiting room, the practice manager could get involved, so everyone can help get the information across.
Number one, what I'd say to practice managers is that this is really a very important program. Also, they need to ensure that they've got good policies and systems in place. It's very important that they also have all of the staff and keep their staff informed of any updates, and this just makes the entire process so simple.
Within any program, administration is part of it, as the GP knows, and with the National Bowel Cancer Screening Program, they've really tried to simplify the workload for the GP and for practice staff.
With having an online form, it really is a very quick and easy process, but we still have some doctors that use the paper-based forms, but they're still really quite easy to get through.
If I were to leave general practice with one key message, it would be that bowel cancer screening is effective in saving lives.
It could reduce the number of deaths from around 80 per week down to 30 or 40 per week, but that will depend on participation. And general practitioners have a huge influence on patients' attitude and on their likelihood to participate in the program.